Many health workers, especially medical doctors, are gradually exiting the country, leaving the doctor to patient ratio at 1 to 10,000 as against the recommendation of the World Health Organization, which is 1 to 1,000. Nigeria has recorded the largest number of foreign medical doctors working in the United Kingdom after India and Pakistan. Reports say that at least 5,000 qualified Nigerian doctors have moved to the United Kingdom in the last 8 years due to poor working conditions and low remuneration. Sadly, this is occurring at a time when the country's population is on the increase and many Nigerians suffer to receive basic health care attention. Well, joining us via Zoom from Abuja to discuss how we can resolve this issue is a medical doctor and public health physician, Dr. Obinna Ebirim. Good morning. Thank you for joining us on TVC Breakfast.
Good morning. It's my pleasure to be here today.
Right. Let's begin with the picture being painted that the situation is now one doctor to about 10,000 patients as against the WHO recommendation of a doctor to 1,000 patients. Paint us a vivid picture of what it is like if this really is the case.
Thank you. I think that is a true picture or even an underestimation of the current situation because right now I'm a medical doctor and I am married to a pharmacist, and I can tell you for free that most of my colleagues, ranging from those that are just finishing their housemanship and those to those that are consultants, and even the pharmacists, they are living in drones and the popular countries are Canada, UK, US. And in fact, amongst those that are said to be left in the country, I can tell you for free that 30 to 50% are either waiting for their PR status or waiting for them to be listed for the residency program in the US, or trying to finalize the processing of their paper to go to the UK. So it's a very serious situation because you need these health workers to take care of the population, and when these health workers are living in large numbers, it just means it portends a serious danger to the health system of any country. And just to say that we look at pay, the state of the health system, as the reason. I just want to say that is just the internal reason. There are other external reasons. I want to say, and I want to argue, that the brain drain in the health sector is just one of the symptoms of the state of affairs of the nation.
Well, thank you for illuminating this. Can you tell us a sense of this remuneration that our doctors are hankering after, and can you compare them? If you don't have specifics, but can you let us know what the estimate is?
Okay, let me paint the picture. So, for example, a junior reg, we have a junior reg who just passed the primaries and got into the system. I think he's paid 100 and something thousand, and then when you become a senior reg, you go to 200 and something, and then consultants earn, I think, about 400 and something thousand per month. Now, this is in a country where the public schools are not well functioning. You have to put your child in a school, and then you know what the school fees are, especially if you're living in cities like Abuja and Lagos, and then you have to take care of your family. You have to dig a borehole for yourself. You have to try to take care of your social amenities and fuel your generator. And that's why I say that the problem is not just only remuneration. It's not just only the lack of diagnostic tools to practice medicine as you should practice. It's not just a problem of poor insurance coverage that means that sometimes we doctors and even nurses and other health workers have to contribute to pay for some patients who are held back because they cannot pay their bills and get discharged. And then we have to battle nosocomial infections or infections due to prolonged stay in the hospital. These are not the only issues. It's also a problem of that you do not have some of those social amenities that can cushion the effect of your expenditure, right? So that when you aim, you can actually live at least the minimum standard lifestyle. And that is also one problem. The other problem is the fact that you also have to practice amidst the insecurity. There have been stories of doctors being kidnapped or their families being kidnapped. You can see the issue of flooding. The other day we saw on social media how the Federal Medical Center in Bayelsa it has been taken over by the flood, right? So a combination of all this, the pay, the state of the health system, right, and all that social factors makes it difficult, really difficult. And also, you don't even have your tools. Practicing medicine in a public health system, in a public facility in Nigeria, is actually very frustrating. You have to improvise. Sometimes you don't have a tourniquet, you have to use a drip stand to act as a tourniquet to maybe get a blood sample. You don't have something to maybe get a sample, you have to break a needle, right? Sometimes there is power failure, you have to use a torch, right? So it's frustrating. You read all those nice things in your textbook when you're being trained as a medical doctor, but you do not have the tools unless you're working in one of those big private sectors. So those are the issues. It's not just a matter of pay. Yes, we need to increase the pay, because when you also look at what our colleagues elsewhere are earning and their quality of life, you can't but be tempted to go to those countries to practice. But even if you are so patriotic and passionate about your country, then you are now you have to deal with issues of insecurity, issue of high cost of items, high cost of education for your children, insecurity, and you have to really take care of everything. It's like they're doing both the work as a government and the work as a family man. You have to take your power, light, everything. So it's actually frustrating. And that is why the solution is not just increasing pay. You have to increase pay, you have to fix the health system, and you should make sure that you have those social amenities and the environment is conducive to practice medicine, to live at least the average standard of living.
All right, Dr. Ebirim, we all understand the consequences of people, professionals of the caliber of doctors and all those professionals leaving the country. But looking at the bigger picture, or the long-range picture of things, some people have said that it is blessing in disguise for Nigeria. Someday when things are okay and all those doctors want to come back, we're going to have a surplus one way or the other. What do you say to that?
I don't think it's a blessing in disguise, because you have a population to take care of. And for one reason or the other, especially given some of the environmental issues and hygienic issues in this country, and also the global health insecurity, infectious diseases, and the rise of NCDs, people will fall ill. People will need health care. So there is no blessing, because the question is, would people be alive to even see those days, the days of blessing that is coming, when doctors need to come back? No. So people have to be alive to witness that. So I don't think it's a blessing in disguise. It is actually it's actually endangering the population, because what will happen in the long run is that people will not have access to health care, because there is they don't have the appropriate health professionals to take care of them. It would lead to people dying, reduction in the life expectancy, and then you are losing also your workforce. You're losing, you're spending more in terms of having to, in terms of the general cost of not being able to provide quality health care for your people. So I don't think it's blessing in disguise. It's an imminent danger. And the thing is that if it's something that we've reached a peak and we are coming down, you can say, okay, there is light at the end of the tunnel. But what I can tell you is that it will get worse, because at the moment, you can't, even as a medical professional, I can't look forward and say, hey, maybe if I stay till maybe next 2 years, I can see a better Nigeria that can afford me quality remuneration and a good standard of living. People can see that. So it's only can get worse unless, in quote, something miraculous happens. So I don't see it as a blessing in disguise. I see it as an imminent danger that needs to be forestalled to prevent things from getting even worse.
When you say something miraculous, I wonder what that would be in your point of view. That's on the one hand. On the other hand, the question is, how do you think we got to this point?
So I think, just to say, not to be sound so political, I think there is a problem of leadership, right? Leadership cutting across all sectors, right? Because if you have the right leadership, you'd have fixed the health system, you'd have increased, and then you know that health is such an important. In fact, look at the days of COVID, because the health of the global health was affected, the health of countries were affected, all aspects of the economy, all aspects of the country were affected. So health is just so important, right? But the question is that, are we putting our money where our mouth is? You have a situation whereby you called all the heads of states this country in 2011 and reached the Abuja Declaration of 15%. Other countries that attended in your country have reached 11%. Nigeria is still moving. It's 5%, 6%, 7% of the budget, right? So that means there is no priority amongst leadership for health. So the first thing is, it's a question of years and years of failed leadership, years and years of lack of prioritization of the health of the nation, right? And also years and years of corruption and mismanagement in the health sector. Some years ago, we heard about the fraud with Gavi, the Global Fund. You are complaining you're not getting enough, the little you're getting, there's issues of corruption, right? So I think that we got to this point because years and years of failed leadership. And that is what I mean by miraculous, right? I'm a very optimistic person. I believe that this country will be great again. I believe that if you get the leadership right, if you get a leader that prioritizes health and invest more in health, and not just only throwing more money to health, but making sure that funds are judiciously, efficiently, and effectively utilized, right? And then you have a holistic view of strengthening the health system, not just building facilities, right? Or say, let us employ, right? But making sure that all the pillars of the health system are uplifted and managed, right? When you get that leader, right, then you begin to see that there'll be more remuneration, there'll be increased health insurance coverage so that doctors don't have to then use their meager resources to pay for patients who cannot pay. Hospitals will be well equipped. The health workforce will be well trained, right? You would have adequate supplies and drugs. And then you see that even if you're not being paid like your colleagues elsewhere, there will be that joy that you're practicing medicine as it should be. Not you're improvising, not that you prescribe drug for a patient and the patient cannot buy, and you might be thinking, hey, this one, he cannot purchase this drug. Can I think of a less effective drug? Hey, it's better to give something and not to give something. And then you're practicing a medicine like you're pricing crayfish in the market or something. So it's a real problem, and it's actually very frustrating. So I think that we can get it right, but to get it right, we need good leadership, we need prioritization of health, we need more funding of health, we need strengthening of our health system, and we need improvements in the social amenities, in the basic needs of a common Nigeria, because a doctor, a nurse, a pharmacist also lives in this community, and they face these issues that make our salaries nothing to even live on.
I read in a newspaper recently, in the news recently, about complaints of Nigerian doctors abroad. They are overburdened. They work excessive hours. They are not protected, even within their terms of employment and engagement, by the same laws that indigenous doctors enjoy. They are suffering discrimination there. Some of them have complained about it. Are doctors aware of this prospect of serving as second-hand citizens, even as professionals, and what do they think about it? Because one of those who complained said that he was working so many hours, or like 15 hours a day or something like that, and he was afraid that the burden, the drudgery may affect his production, and he was afraid also of hurting any of his patients. Are you guys aware of this prospect?
Yes, people are aware, but the funny thing is that when people look at their paycheck and the conversion and the exchange rate and what it means for their family back home, and probably a doctor who have been working from his days as a medical officer to a senior reg, house of senior reg, junior reg, senior reg, and a consultant, and he can barely afford a pencil-light Camry, and his shoes are almost eating up. The children cannot go to good schools. Maybe he has to juggle between some in private, some in public schools, just to make sure he meets. And then he knows that he goes to UK and he works for very long hours, and then he gets maybe a 2,000, 3,000 pounds a month, and then he brings it back, maybe just 1,000 of that, or a 1,500, and that's going to up to 1 million. And it's not any more than his consultant back home, right? And he will suffer. But you see, the problem is that, there's this relationship between the employer and employee. Once people know that the employees are now desperate, there is this tendency to take advantage of them. And this is so sad, because this is the situation their country has put them in, where they know that they are not getting their rights as workers, but what can they do? In fact, that would be the silent question or unspoken question the employers will be asking them. Hey, what can you do if you don't like those rights? Why don't you go back to your country? And you cannot go back to your country, because even returning to your country, because there's also some issues about leaving. Some people say that that the number is small, but the question, there's also a problem of absorptive capacity. I can tell you that just yesterday, was it the NME that mentioned that we have about 20,000 doctors now taking care of the population. But amidst that low number, that very low number, people still struggle to get housemanship placement, residency spots, and even after training to become consultants in public health facility, there are no spaces, right? So the point is, these things we know. The doctors who are immigrating, those that are on the queue waiting to get their visa or the PR or get enlisted or shortlisted into the US system, they know these issues of discrimination, issues of suffering. But the question is, what are the options left for me? Do I stay back and continue to struggle and it's not like I'm not getting paid well, I'm practicing my profession in the right way and I'm getting that satisfaction? No, what will they do? So it's more like a desperate situation, and that is why, despite them knowing all this, they are still moving in their numbers to these countries to practice. And I think that it's not fair. I think that the nation, the country should do well to strengthen the health system, to increase absorptive capacity, to make sure to increase doctors' remuneration, to increase fund of health, so that we can keep our best brain. It is not really a good thing that you're losing your best brains to other countries, and they're helping developing their health system, taking care of their population, while your people are suffering, while your people are dying. I don't think it's fair. I think we need to reverse that trend.
All right, Dr. Ebirim, we've seen in subsequent budget allocations to the health sector has been poor by the government of Nigeria. Budget after budget, year after year, we've seen between 4%, 7%, between 4 to 7%, that range of allocation to health. And of course, one would say that is very meager. But if government, considering what's going on right now, if government has to take the step to say, okay, you know what, we've realized the dangers of allowing health professionals to emigrate from the country, and we need to do something about it. Where will government start from in that regard if a comprehensive or a holistic overhaul of the system has to take place?
So I think the first place to start is increasing the budget for health. Take it up, but don't stop at that. It's going to be a holistic approach. It's not just like a vertical, you just do this and no. That will be the first. Then the second one would be to strengthen the health system. So there are the various pillars of the health system: the governance, the human resource for health, even research, supply, the drugs. They are those various pillars, then the service delivery pillar. Now you have to strengthen all the pillars. You don't just take one and say, okay, I want to increase funding, that's health financing. And then, in fact, even in health financing, you have to think of how do you enroll, what are the right policies and plans to enroll more into the national, into the increased coverage for health insurance, right? And you have to train your health workforce. You then have to ensure that the governance system is right, because you can throw all the money into the health system, but because of poor management, corruption, inefficiencies in the system, duplication of function, you will then end up not getting the best in terms of the health outcomes and the health indices, right? So it's going to be a holistic approach that includes increasing funding for health, strengthening the various pillars of the health system, making sure that you are effectively and efficiently managing those resources, and then ensuring that you are prioritizing those key aspects of the health system. So if I am today made a policymaker or in a position to take care, I'm not going to start with building cancer centers, tertiary, those things are important. Yes, you have to take care of them. We have to start with the primary health care system. It is that level of the health system that takes care of about 60% of the health needs of the population, right? So if that's the pillar, strengthen it, make it strong, make it to be able to stand, to be sustainable. So that, because what you have also today is that most of the needs that should be taken care of at the primary health care level, that can even be manned by a matron, right, is not being taken care of at the tertiary level. That's the teaching hospitals and the federal medical centers. So you have what we call an inverted code, right, where the area that's supposed to take the less load is now taking more. And that is why you see that even the little doctors we have are overworked and they're not giving in their best. So it is a holistic approach, not just increasing funding, not just increasing pay, but you must strengthen the health system. You must make sure that you tackle a lot of the inefficiencies and corruption in the health sector. That to me is a way to get it right. And you would see, what you're going to see is that you're going to see decreased maternal mortality rate, the number of women that are dying. You will see that there will be increased life expectancy, right? You will see a reduction in child death, right? Those things you will then begin to see that you now know that, okay, you're doing the right things to strengthen your health system. That to me is the solution.
In proffering solution as well, the president of the Nigeria Medical Association has called for the establishment of a health development bank to facilitate this development in the health sector. I wonder what you make of this suggestion that he has made.
So I don't really have the details about what the Health Development Bank will do. So I won't want to kind of shut down that idea. But to me, I feel that that is just one of the pillars. It would deal with the health financing pillar, right? As I mentioned earlier on, you need to take care of other pillars, right? The service delivery, see, you can also put 15% of the national budget in health, but if you've not implemented the health law that talks about the National Health Act, that talks about the quality of service that should be given at these health facilities and how you can hold the health worker accountable, you might put in a lot of money and you will not be getting the value in terms of health, improving health indices. So my recommendation today is government increase funding for health, which would also lead to increased remuneration for health workers, but also make sure you're dealing with other pillars of the health system. Our health workforce, are they well trained, right? Do you have the appropriate, not just number, but distribution of the health workforce, right? Do you have incentive that make maybe doctors want to work in local secondary healthcare, the general hospitals? So it's a holistic approach that is required and not just looking at one end, because then if you fix that end and the other issue, so for example, even if you pay doctors 800,000 or 1 million naira, and tomorrow the inflation rate in this country is going high, so that now a bag of rice now moves to 100,000 or 200,000, right? You will still get people complaining because their purchasing power is reduced, right? So it's something that you need to deal holistically and not just looking at one aspect alone.
Now, we recall that during the COVID, the president made some promises with regards to, I think, health insurance, increasing the welfare, basically, of the health workers. Where are we with that? And what has been done with perhaps pressuring the government to do something or deliver on that aspect? And then there's also the issue of government saying that at this point, with the economic situation, they don't have monies to deliver on certain promises or on certain sectors. Recall the situation between even the medical doctors and the labor minister. And we also saw the issue of ASU and the labor minister, where the government is saying we do not have that money. In fact, our budget is on deficit as we speak. I wonder where this leaves us if we're having this, as we have this conversation now.
I think I have a simple answer. If you feel you don't have the money to deliver on your budget, if you feel you're now incapacitated to deliver on your promise, which is the minimum thing you can give to your people is the health and well-being, I think you should follow the path of the British Prime Minister, Liz Truss, who resigned yesterday. She came and said, I cannot do what I promised I would do because of XYZ reason, and I'm resigning. I think our leaders should learn to do that. Because the truth is, even in the private sector, right, you have situations whereby you have plans, but you are constrained by budget. And that is where you have to wear your innovative cap to think of ways to get the money, the funding, the resources you need, right? And sometimes it's common with startups. You think that the only problem is money. But if you think critically, you will find out that there are low-hanging fruits you can leverage upon to improve things. So I don't think that the global economic issues, the economic situation in Nigeria is an issue. The question we should be asking those that are our leaders is that with the economic meltdown, with the so-called we don't have the resources, have the senators failed to receive their salaries? Have those working in the presidency, the ministers, have their salaries been paid? Have they received their allowances? Have we cut down on our number of trips? Are we being efficient? Have we cut on the number of convoys, the number of cars, the number of trips we go trips abroad? Have we cut those excesses and wastages in government? So it's not a good argument until you can really see that there's actually the economy is biting and there is a deliberate effort to cut costs and reduce wastages. So it's easy to look at doctors or health workers and say, hey, you don't have enough money to pay them, or the situation like the earlier question you asked, where during the COVID-19 they paid for some months, they paid their allowances, and then at the end of the day they stopped. Whereas health workers are increasingly increasingly facing dangers. I recall days as a house officer where you would go to that ward, that last ward 9, where you have people who are already at end stage, maybe HIV/AIDS and all that, and you would be looking for a line, trying to get line. Sometimes we have had doctors who, in the process of trying to, you get a needle prick, and you know that this patient is having a disease that is infectious, and you have to run them to go and take prophylactic drugs, right? Doctors, health workers are facing huge risk in our health facilities because, first of all, you don't even have the tools, right? And then it's easy to say, oh, you don't have the resources. You don't have the resources, and every day people are traveling abroad for headache, for catarrh and this thing. We know how many of the current aspirants who are running around for healthcare. If you don't have money, then come here and treat. And we know you don't have money to go abroad. So that is not a good excuse. That is not a good argument. I think that it is what I would call a failure of leadership. And that's why I say that the brain drain in Nigeria is just one of the many symptoms of the state of affairs of the country. Because if you get the right leadership, then there will be a solution. It is not right, it's not acceptable, whether in public life or in private life, to say that because of funding, that's what you're not supposed to do, what you're supposed to do, and your people are dying. And you come and say, oh, the economy. It's a problem everywhere, but countries are finding innovative ways to finance. They are putting same taxes, they are taxing luxurious goods, they are taxing sugar, sugary drinks. These are ways they are raising funds for the health system. So it's not just about government allocation. There are various ways to raise funds for the health system, but it takes a leader who thinks.
All right. We have to leave the conversation here now. Dr. Obinna Ebirim, a medical doctor and public health physician, thank you for your time on the program.
You're welcome. It's a pleasure being here.